The US has launched a scathing attack on the World Health Organization at its annual meeting of the member states. The US Health Secretary Alex Azar said the WHO had failed to obtain the information that the world needed, which cost lives in the pandemic. Have a listen to what he had to say.
In an apparent attempt to conceal this outbreak, at least one member state made a mockery of their transparency obligations, with tremendous cost for the entire world. We saw that WHO failed at its core mission of information sharing and transparency when member states do not act in good faith. This cannot ever happen again. The status quo is intolerable. WHO must change, and it must become far more transparent and far more accountable.
Well, the WHO hasn't responded to those allegations, and although the US Health Secretary didn't name the country explicitly, previous comments do give us a clue. Throughout the pandemic, the US has called on China, where the outbreak began, to be more transparent. It's a message that we've heard again and again. Well, today, President Xi Jinping had this to say to critics.
All along, we have acted with openness, transparency, and responsibility. We have provided information to the WHO and relevant countries in the most timely fashion. We have released the genome sequence at the earliest possible time. We have shared control and treatment experience with the world without reservation. We have done everything in our power to support and assist countries in need.
Well, let's get more analysis from our China correspondent, Steve McDonnell.
He's saying China has been completely transparent. He said that his country supplied the genome sequence as soon as it possibly could to the rest of the world, but then went on and said that China was going to pledge $2 billion in support for developing countries trying to tackle this emergency. Chinese hospitals are going to pair with 30 African countries. He's going to set up a sort of global response base in China for emergencies like this in the future. And also said that, pushing again into the future, that when the emergency calms down, there needs to be a sort of good look at the global response with its inefficiencies, what went wrong, what went right, with a view to completely overhauling the way all countries have handled this. And the message was that really we have to be able to do better than this because there could be more disease emergencies like this coming in the near future.
Well, all member states, that's 194 of them at the WHO, met virtually as leaders push for an independent review of the global handling of the pandemic. WHO Chief Dr. Tedros was first to speak, urging countries to be open to scrutiny. He made this announcement.
I will initiate an independent evaluation at the earliest appropriate moment to review experience gained and lessons learned and to make recommendations to improve national and global pandemic preparedness and response.
Well, South Korea's President Jae-In also weighed in. He called for the WHO to be given more legal powers to ensure countries report outbreaks and share data.
We must update the WHO international health regulations and strengthen them with binding legal force. A new infectious disease could emerge at any time, and we must be able to respond more quickly and effectively. Infection-related data should be shared among countries in a more transparent manner, and an early warning system and a cooperation mechanism must be jointly established.
So was there any message of unity during this meeting? Well, here's our global health correspondent, Tulip with more.
Well, certainly for the first 4 hours or so as countries came online, and most of them were really supportive of the WHO, talked about global solidarity at the time of this pandemic. And we do know, that, as you've been hearing, that there are calls, international calls led by the EU and Australia for this independent inquiry into the WHO's handling of the crisis. But all of this sort of goodwill kind of stopped when it came to the US's turn. And you heard the US representative speaking there. They were very, very critical of the World Health Organization. They didn't name China, as you mentioned, specifically, but talked about a member state that hasn't been completely transparent. So this is really the World Health Organization stuck in the middle of a bigger geopolitical fight between China and the US. Now, the US isn't by far the only country that has criticised China for not being transparent enough at the beginning, and also has criticised the WHO for being too praising of China, and also potentially declaring a pandemic too late and not handling it as well as it should have done. But really, this has become, this has sort of clouded conversations today. Like I said, most other countries were very supportive of the WHO, but this will be the headline, I think, coming out of this meeting.
And moving forward, obviously now there has to be some kind of cohesive action between the member states, the willingness to be transparent and share data when it comes to virus infections and deaths. Is that likely to happen?
So South Korea, as you heard there, is calling for the WHO to be given more teeth, more powers to actually get countries to give information, make sure countries give information. Remember, the World Health Organization is an advisory body only. It can't enforce its advice. It can't force its way into countries to do independent investigations. And that is what South Korea and also Australia have been pointing towards. They're saying that WHO's mandate needs to be widened in order to do that. There will be discussion around whether that will be included going forward for the World Health Organization. It's important to say that WHO did actually get into China in January and February of this year, but it was invited by China and it was alongside Chinese officials. What other countries are saying now is that the WHO should go completely independently so it can find out the source of outbreaks, not just in China for this outbreak, although that is what's needed more pressingly, according to a number of countries, but also for future outbreaks. And I don't think China is going to go for that, but other countries will also have to agree that if outbreaks happen in their countries, that they'll allow an independent team in. And I think that is a sensitive issue. So I don't think anything's going to move on that very quickly, but it could be that they do make some sort of commitment to looking into that when the pandemic is over.
Before the WHO meeting got underway, more than 140 world leaders and experts submitted this open letter calling for a people's vaccine that is free and equally available to all nations. Its main message is this: only a people's vaccine with equality and solidarity at its core can protect even all of humanity and get our societies safely running again. A bold international agreement cannot wait. Well, one of the signatories to the letter is Professor Mariana Mazzucato from University College London. Let's have a listen.
There's basically three demands in the letter. The first is to ensure a mandatory worldwide sharing of all COVID-19 related knowledge. In other words, in an era where we talk about big data and collective intelligence, this is the moment to walk that talk. And that does have to do with, for example, creating patent pools and really making sure that any knowledge is enforced in terms of the licensing capability so it doesn't remain secret. The second is to establish a global and equitable rapid manufacturing and distribution plan so we can actually make it for everybody around the world. And that really has to be funded fully by rich nations. And third, we have to guarantee that the vaccines, the diagnostics, and the tests are provided for free of charge to everyone.
Scientists around the world are working at record speed to develop a vaccine for COVID-19, though most experts tell us that it's unlikely one will be ready in the next year. However, we have had a positive development. Today, we heard the first US company to carry out human trials into a COVID-19 vaccine has reported positive results. Moderna is a biotech firm based in Cambridge in Massachusetts. It says its vaccine produced antibodies that could neutralize coronavirus. Scientists say early results showed the levels of antibodies were similar to those in blood samples of people who had recovered from COVID-19. The company says the vaccine was generally safe and well tolerated, with a safety profile consistent with that seen in prior Moderna infectious disease vaccine clinical studies. Well, the BBC's health and science correspondent James Gallagher cautions this is only phase 1, and the next stage of the trial, which begins in July, will determine whether people are protected against the virus. So there are still many challenges ahead. Here's Moderna President Dr. Stephen Hoge.
Our goal is to have a vaccine available for broad distribution by year-end or early next year. Now, the question, of course, that's out there is, as we start to build data over time, and if we and others build data that shows that the vaccine has a potential for benefit, that it's safe and has a potential for efficacy, then of course there are circumstances where the vaccine could be deployed to high-risk populations earlier under something called an emergency use authorization. Really, though, that's a decision that regulators, in particular the FDA, have to make.